Hi, Dr. Dominic here with Elite Facial Plastic Surgery. I hope you're doing well. My voice sounds a little froggy because I'm getting over a cold, so bear with me. I'm also doing the video today from my operating room to kind of mix it up and get better lighting. So today I want to talk about rhinoplasty and what questions that are often arise with patients. A lot of times patients are nervous. When you're coming to a doctor's office and you're thinking about doing surgery yourself for elective reasons, you don't kind of, ask the questions that you wish you would have. And I think some of the questions that patients often are inquiring about is what to expect. And from the initial consultation, you should feel comfortable with whomever you meet. That person should, want to talk to you, get to know you, and really understand what you're looking to do with your nose. With that, I think the best way to kind of convey what you're trying to achieve for you, your individual nose, is with imaging. So with that, you should definitely think about having some imaging done with your surgeon, or have some imaging that you've put on your phone. Now, granted, you got to, give us some leeway to understand what you're looking for, because we can image whatever we want these days. But that's where that initial consultation where the surgeon can look at your nose, appreciate the anatomy, and then be able to give you an honest opinion, and then hopefully illustrate that to you with imaging. Now, the next step with all that is moving forward with it. And a lot of patients are nervous because, again, when you get online, you look at Dr. Google, you can get all kinds of stories and the different gamut. But I would say, as a rule of thumb, most patients describe their postoperative period as being sore. And normally with that soreness, it can usually be managed with Motrin. Sometimes patients need some pain meds, but it usually shouldn't be more further than a day or so. Now, with that, you are going to have some bruising and you are going to have some swelling. But depending upon the extent of your rhinoplasty, about what is done, will determine the bruising factor. Normally that bruising should subside after about 14 days. And during the first week, you're going to have a splint on your nose that's really going to be compressing things, trying to keep that swelling down. So during that period, you're going to feel real stuffy, congested. It's totally normal. And then normally in my practice, when you follow up, it's about 5 to 7 days later, we'll take that splint off. And then there are 5 little sutures that come out from the outside of the skin here. The rest of the sutures for an open rhinoplasty approach are going to be inside the nose. Endonasal approach, you will still have sutures inside the nose. With the open, you'll have just 5 little sutures here that come out, and that incision heals up great. After that, during that visit, you may need to get your nose suctioned out. And the reason why we do that is if you've had functional work, what we call a septoplasty done, sometimes you got to have splints removed. I personally don't use splints in my practice, but other surgeons do. It's not a right or a wrong thing. It's just a technique thing. And after that point, you have your nose suctioned out. Usually you'll start to be breathing better. And then again, after that 5th to 7th day post-op, that's when all the swelling starts to settle out. But realize the swelling in the nose itself will take 9 to 12 months. And again, if you get online doing your reading, I think as a rule of thumb, standard care is give your nose about a good 9 to 12 months to let it settle. With that though, it's not like you wake up in 9 to 12 months and poof, it's gone. It's more of just a gradual process. And the swelling gradually goes down, starting at the top, working its all the way down. And the last place to fully settle is going to be the tip. Now, another question patients have been asking me lately is, wanting to tape their nose, for extended periods. I usually tell patients to, avoid doing that, because what can end up happening is sometimes people can be a little overzealous and they think, okay, if I should put tape on, I'll do it all day long, or I'll put more heavier tape. I usually recommend putting tape on for the first 10 days. After that, whatever swelling is there, just give it time to settle, be patient, follow up with your surgeon, and they can, hold your hand through the process and just explain to you that this is normal. Sometimes I will have patients massage certain areas of the nose to help with swelling. But again, usually once you hit about 9 to 12 months, however the nose looks at that point, it's settled out. And lastly, I really want to drive home that this process, certainly a rhinoplasty, should not be painful. I think soreness is a very way to describe it. And initially, some patients may need pain meds for a day or so, but then after that, most patients' discomfort can be managed with Motrin or Advil. And then at that point in time, you don't even need anything. So I hope this helps to, address some of the questions and concerns that may be on your mind when it comes to rhinoplasty. If you have any other questions about rhinoplasty, feel free to look at our YouTube video library. We have a lot of videos on there. If you have any questions, give us a call. We love talking to patients. Have a great week.